Hi everybody! I have been asked to recommend some books in the area of mind-body healthcare. So today I would like to introduce this one. It's called Meaningful Disease and the author is Dr. Brian Broom. Brian is an immunologist living in Auckland who realized that a lot of his patients had illnesses that somehow linked to their stories. And so over the time he became more and more interested in the influence of mind on illness, and particularly the role of the story. And he has identified that there are some illnesses that somehow are highly symbolic of the story, of the circumstances that a person is going through at the time. And he calls those somatic metaphors. So in his book, he gives many examples, but the one that really comes to mind for me today is one of a lady, an elderly lady, who suffered a fall in a shop and felt really humiliated by the fact, and after that somehow retrieved into her home, not going out, and describing herself as going into her shell. Shortly after that event, that lady started developing scleroderma, which is a illness of the skin, a dermatological condition characterized by a thickening of the skin. So, very interesting, her going into her shell and developing a thickening of the skin. And the interesting part of that case was that she was not very receptive to psychotherapy at all. But her illness started improving once a friend of hers forced her to start getting out of the house and back into the community. Now that concept of somatic metaphor for me was like a yay discovery, a Yahoo experience, because I had seen a number of somatic metaphors over the years. I believe the first one that I recognized as mind-blowing was probably my third year of medical training. I went to my first psychiatry class and we were asked for an assignment to go and interview anyone in the hospital with any condition and ask them how their illness had started. And so I chose a lady in the hospital who was suffering from lupus. Now lupus is a very serious autoimmune condition where the person's own immune system attacks their cells and it can get very nasty. This lady, she had basically terminal kidney disease, and she was in dialysis, and she had all sorts of other manifestations, but importantly she also had one of the dermatological manifestations of lupus, which is discoid lupus, and it looks like black blotches of plaques on the skin, not very good look. So I asked this lady how it had all started, and she told me that she was in a marriage and she had 4 kids, and one day her husband just left. And after he left, she was first very resentful for the fact that she was left to raise 4 kids with no money, only debt, and that she had to find herself a way to survive. And so she did. She went on to work, and she was working something like 2 or 3 shifts every day. The kids were looked after by the grandmother. This woman became gradually more and more resentful, and she also started eating more, exercising less, and so became obese. And not only was she resentful about the husband, but also asking herself the question as to what it was that was in her that had made her not desirable. So one day she told me, as she was getting dressed to go to work, she looked at herself in the mirror. And looking at herself, she said, "Look at you, you're disgusting. You are disgusting. You look like a frog." And she started going, "Brr, brr, brr." And 10 days later, 2 weeks later, she started developing the discoid lupus. Now that's just an example of a somatic metaphor. I've seen many of those over the years, and I think just like Brian, I think that once you have the mindset to recognize how the story links with the physical symptoms, you can make the connection between the two and you can recognize these somatic metaphors. Thank you.